Ma'am, roasted sponge.
Roasted sponge. Good. Can you tell me how spongia is prepared?
Ma'am, firstly, the roasted sponge is roasted till it turns brown. Then it is triturated, like its skeleton is triturated till it becomes like sand like.
Okay, so it is triturated and then converted to the liquid potency. Okay, so the sponge is roasted till it's brown. The roasted sponge is not roasted. The sponge is roasted till it's brown, and then the powdered skeleton is triturated and then converted to the liquid potencies. Okay, so this is the preparation. And who introduced spongia into our Materia Medica? Who introduced spongia into our Materia Medica? Okay, Dr. Constitution of spongia. Can anybody tell me the constitution of spongia? Okay,
Ma'am,
Anam, can you
fair
tell me the constitution? Yes. Who is speaking? Anybody else who can tell me the constitution of spongia?
Ma'am, fair complexion, not that toned muscle fiber.
Okay. So, lax muscle fiber, fair complexion. Yes. And then?
Marked well in children and women.
Fine. And
Ma'am,
like, what is the
tubercular
diathesis of sponge?
Ma'am,
Scrofulous
tubercular or
diathesis, ma'am.
scrofulous diathesis.
And
Tubercular
scrofulous and
diathesis.
Tubercular
tubercle.
diathesis.
Okay. So, and what do you understand by the scrofulous diathesis?
Primary tuberculosis of cervical lymph nodes, ma'am.
Okay.
A tendency of
Yes, the term scrofula comes from tuberculosis of the cervical lymph nodes. Okay. So, and the diathesis is actually these people are prone to glandular affections with a tubercular background. Okay. So, primarily, what kind of affections does spongia have? What is the sphere of action of spongia?
ma'am, prominently respiratory tracts, heart, glands like thyroid glands and testes, and in respiratory tract, larynx, trachea, bronchial tree, alveoli.
Okay, good. So this is the sphere of action of spongia. Okay. Next, you come to the respiratory symptoms of spongia. Now, what are the 4 prominent respiratory symptoms where you will concentrate in spongia? You will be describing the cough of spongia, the hoarseness, dryness of the mucous membranes of spongia. Okay. So, what else do you tell in spongia? The suffocation of spongia, isn't it? So, cough, dryness, hoarseness, suffocation of spongia. Okay. Now, can anybody of you describe the cough of spongia? Anybody describe the cough of spongia?
Dry,
What kind of
hoarse,
cough does?
barking cough, ma'am.
Dry,
Yes, so
barking, croupy, rasping, ringing, wheezing, whistling. And ma'am,
Like
everything
a
is
sword.
very good. And what is the
and ma'am,
peculiar sound?
he-
Yes.
ma'am, ringing
Like
sound, whistling sound.
Ring.
sword.
Yes. And one
And
peculiar
like a
description
saw
is
driven through a pine board.
Persistent stridor, ma'am.
Through a pine
okay.
board. he feels
No, no.
like.
Stridor is something different, okay? When the patient is coughing, did you see that link which I had in your group? Did you see the link which I had sent in your group?
Yes, ma'am.
Yes. So when the patient is coughing, that sound is produced like a saw driven
Sword
through
with
a
a through pine
pine.
board.
Okay, so it is a sibilant cough. Sibilant means slight musical sound will be there. Okay, so that comes when a saw is being driven through a very hard wood. So when a saw is being driven through a pine board, that kind of sound it comes when the spongia patient is coughing. Okay, so a dry, hoarse, barking cough, this kind of cough is common for all the medicines which have croupy ailments. Okay, and what is croup? What do you understand by croup?
Ma'am, it is another name for laryngobronchitis.
Laryngotracheobronchitis.
Yes.
Tracheobronchitis. Yes, ma'am.
Okay, fine. So when the patient is suffering from croup, three things are there. This dry, hoarse, barking cough is there, hoarseness of voice is there, and stridor is there, isn't it? So somebody of you said stridor. When while describing the cough, what is actually a stridor?
High
What do you
pitched
understand?
sound, ma'am.
Yes, so it is a very harsh, high-pitched sound. This occurs because you know the vocal cords, they are so swollen up and they are so close together that when you are breathing in, okay, when air is passing through them, this harsh, dry-pitched sound it comes. This is known as a stridor. Okay, so it is associated with the cough. Along with cough, stridor may be there. Okay, but the cough is a dry, hoarse, barking cough. And in spongia, what is characteristic is the sound. The sound of the cough, when the patient is coughing, it is a slightly sibilant musical kind of sound is there. Like a saw, when it is being driven through a pine board, that kind of sound comes when the patient is coughing. Okay. Now, so this is the cough of spongia. Now, what are the typical like modalities of spongia? When the patient has cough, what are the peculiar modalities of spongia?
Ma'am, it increases while reading, singing, talking, swallowing, and he feels good when eating or drinking warm things.
Okay. So eating and drinking warm things, patient feels better. So obviously when the patient takes cold water, the cough is worse. The opposite of it. Okay. And what are the other aggravating factors? So spongia cough. One thing you
Sweets,
have. Yes. Go on, go on.
After eating sweet, ma'am.
Yes. So sweets, it aggravates the cough. Another thing.
Smoking, inspiring, exposure to cold air.
Yes. And
lying with head low.
Ma'am, lying with head low.
yes, lying with head low. That also aggravates the cough. So patient wants to lie down with the head high. So the cough is less. Okay. Another peculiar modality in spongia, the cough aggravates with mental excitement. Every mental excitement, it aggravates the cough. Spongia patient is prone to a lot of anxiety and fear. Okay. Now, this is also associated commonly with cardiac ailments. This anxiety and fear, whenever the patient is very anxious or fearful due to any cause, this patient, the cough of this patient tends to aggravate. Okay. So, peculiar, if you ask peculiar modalities of spongia, three peculiar modalities are there. Very peculiar, that is aggravation from taking sweets, aggravation from any kind of mental excitement. The patient feels worse after sleep or sleeps into an aggravation. Patient feels worse while using the larynx, like when reading, singing, laughing, talking. Okay. And spongia, the causative factor of spongia is exposure to cold. Okay. So patient is also aggravated by taking cold drinks, aggravated by exposure to cold winds. Okay. And patient feels better by drinking warm things, eating and drinking warm things. Okay. So this was the characteristic cough of spongia. Now, when the patient is having croup, okay, so patient has the cough that is there, dry hose barking cough, that is common for croup with the peculiar modalities of spongia. What else do you see in spongia when the patient is having croup?
Ma'am, absolute dryness.
Yes, so there is dryness of the mucous membranes. Okay, there is no mucus in the throat, larynx, trachea. There's a rasping, singing, wheezing, whistling, which you have already mentioned. Okay, so there are no mucus trails, so absolute dryness of mucous membranes is there. What else do you see? So wheezing sound is there, isn't it? And the patient feels very anxious. So the face has a look of anxiety. Anxiousness is there in the face of the patient, and the patient is wheezing loudly. The absolute dry sound is there from the respiratory passages. And when does this aggravate? Usually respiratory symptoms of spongia, they tend to aggravate at what time?
Before midnight.
Yes, so before midnight, the respiratory symptoms, they tend to aggravate. And in what what respiratory action does the respiratory symptoms aggravate of spongia? Inspiration, inspiration. Very good. So the croup, there is an anxious wheezing, anxiousness is there in the face of the patient. A lot of wheezing is there. Dryness of mucous membrane is there, because of which absolutely dry sounds are coming from the respiratory passage. No rattling is there. So whistling sound, wheezing sound, rasping, ringing kind of sounds are coming. Okay, and these they tend to aggravate before midnight, and they tend to aggravate from inspiration. Okay, so when the patient is having, okay, now see, the larynx, the vocal cords are coming very close together. Patient is having great difficulty in taking in the air. So what other symptom does the patient give you? Symptoms of suffocation, isn't it? So what is the description of the patient? What is the description of the patient? What does the patient tell?
Ma'am,
Suffocation
he
after sleep
cries
or
and feels he's suffocating as if he had to breathe through a sponge.
Yes, very good. So patient wakes up in the middle of the night feeling suffocated, very much suffocated. Just before midnight, aggravation takes place. So patient wakes up in the middle of the night very much suffocated. Patient feels as if somebody is holding a sponge in front of the nose. Patient cannot breathe properly, and the patient feels very much frightened. Okay. So what else is left? What else is left in spongia? The cough, the croup, the suffocation, and the hoarseness of the voice. Okay. So all these things of spongia, the patient has rawness, sensation of soreness in the throat, burning is there with heaviness of the chest. So hoarseness of voice is there. Okay. So hoarseness means the timbre of the voice is changing. The timbre of the voice is changes. Okay. So the voice becomes rough, scraping kind of voice comes out. Okay, the pitch of the sound changes. So that kind of, if these changes occur, there is hoarseness of voice. Along with that, the patient will complain of a soreness and burning, a sensation of rawness in the throat. Okay, so the patient complains of cough, the patient complains of hoarseness of voice, the patient complains of feeling suffocated during the midnight, wakes up feeling suffocated in a fright. Patient complains of a lot of wheezing and whistling sounds in the respiratory passages, and you observe that there is no rattling. Absolute dryness is there in the respiratory passages. The sounds will give you an indication. If you put the stetho on the chest of the patient, that will give you an indication. No mucus rails are there. Okay, so if these symptoms are there in the respiratory system, then you can think of spongia. Next, in the other class, we had discussed about the cardiac symptoms of spongia. Okay. Now, can you tell me what are the cardiac symptoms of spongia? Cardiac affections of spongia? What are the cardiac symptoms of spongia?
Cardiac dilation, valves cannot close properly, degradation of the blood,
Very
volume of the blood increases.
yes. So the valvular, there is hypertrophy of the heart, there is dilatation of the chambers of the heart valves, they do not close properly, because of which a lot of volume of the blood, because constant regurgitation is occurring, so the volume of blood in the heart, it tends to increase. Okay, because of which there is a lot of when the valves are closing, when the heart is beating, no, lub dub, lub dub. So between that, there are smooth sounds like lub sh dub, lub sh dub. lub dubush. So that kind of, between that clear lub dub sound, there is sh kind of sound. Okay. So smooth sound is there, rasping sound is not there. So because of this regurgitation of blood, a lot of extra sounds, additional sounds are there in the heart when you palpate the heart. Okay, sorry, when you auscultate the heart. Okay. Now besides this, what will the patient complain of? Patient complains of feeling of suffocation and palpitations, and there is pain. Okay, because the blood is not properly going into the aorta, so the blood supply of the heart is also compromised. So patient feels angina. There is pain in the muscles of the heart. This is known as angina pectoris. So these are the three complaints of the patient. Patient feels suffocated, patient has violent palpitations of the heart, and patient complains of angina pectoris, that is pain in the region of the heart. And this pain, it tends to radiate to the left arm, it tends to radiate to the neck, it tends to radiate to the back. Okay, so this kind of, if severe pain occurs on slightest exertion, okay, so when the patient is walking rapidly or maybe ascending the stairs, okay, or the patient is performing any kind of exertion, then these pains, they start occurring, and when the patient takes rest, these pains, they usually subside. Okay. Now, so can you describe what we had described in the last class? Suffocation is very clear in spongia. The patient feels suffocated, which the suffocation feels as if you're holding a sponge in front of the nose. So that kind of suffocation is there. Now, the cardiac symptoms of spongia, usually when do they aggravate? Before midnight or after midnight?
After midnight.
Night.
So the cardiac symptoms of spongia, they have a tendency for aggravation after midnight. So respiratory symptoms of spongia usually aggravate before midnight, and cardiac symptoms of spongia, this angina, these palpitations, this suffocation, it tends to aggravate after midnight. Patient suddenly wakes up in the middle of the night, after midnight, and they have violent palpitations in the heart. Okay, with a lot of pain, with a lot of gasping respiration. Okay, and there is a contracting pain in the heart, and the patient has hot flushes, feels as if whole body is becoming hot, head is becoming hot. Okay, the patient feels very much faint. There is a lot of anxious, the face looks very anxious, and there is a lot of sweat. Okay, and all these symptoms, they tend to aggravate after midnight. And there is another association. Usually, if it is a female patient, these symptoms are also associated with the menses. Before and during menses, these palpitations of the heart, etc., they tend to aggravate. Is that clear? So, these are the cardiac symptoms of spongia. Now, besides this, what else do you get in cardiac symptoms of spongia? We had mentioned some concomitant symptom along with the cardiac symptoms. What concomitant did we mention? Anybody?
When the patient feels scared that as if he is going to die.
Very good. Very good. So the mental concomitants are there along with the cardiac symptoms. There is great anxiety. Okay, the patient has a great fear of death, and the patient fears about the future. What is going to happen in the future? If I die, what will happen to my family? What happens next? What is going to happen in the future? Okay, patient feels as if something terrible is going to happen. Okay, and when these palpitations, when this angina is taking place, okay, so what happens is the patient wakes up in the night and he's very anxious and he feels very disoriented. He cannot recognize his surroundings because of such great fear. So much fear is there in his heart, in his mind, that he feels he cannot recognize his surroundings. He is very much disoriented. And when it is only after some time that he can recognize that he is in his house and his surroundings are familiar to him. Okay, so these are the mental concomitants which might be there along with the cardiac symptoms of your spongia patient. Okay, now what else does a spongia patient tell you when there are such cardiac symptoms? Any idea? So when there is such increase in the volume of blood, what else can the patient complain to you of? patient says that there is a violent surging of blood into the heart, into the chest, as if, the chest cavity is being pushed outwards. So that kind of violent surging of blood into the chest cavity, the patient feels as if the chest is so much congested, as if so much blood is being pumped into the chest cavity. The patient feels as if the chest is being pushed outwards. So that kind of complaint the patient might have. So there is violent ebullitions of blood. Okay, and the veins of the patient says that my veins and everything, they are feeling so distended, and the patient feels as if the chest is going to burst out, as if the head is going to burst. There is a rushing, there is a bursting kind of headache. So this is another complaint of your spongia patient when there are cardiac affections. Besides this, previous class also we had described that spongia patient with cardiac affections can suffer from cough. Okay, so when there is cardiac dilatation, didn't we say that recurrent laryngeal nerve is affected? That is why the patient can suffer from a chronic sympathetic cough when there is organic disease of the heart. Okay, so a cough might also be there in your spongia patient when there are cardiac affections. So cough can be there due to affection of the respiratory tract. Cough can also be there due to, this is a sympathetic cough when cardiac affections are there. Okay, and in cardiac affections, usually spongia patient complains of dryness of mucous membranes. But if there is cardiac affection and congestion of the lungs, then what kind of expectoration is there in your spongia patient? What kind of expectoration is that? Yes, greenish yellow expectoration. Okay, so with your cardiac affections, what points will you tell in your spongia? If you are asked about cardiac affections of spongia patient, what points will you tell? You will tell about the violent palpitations which occur in the middle of the night with a lot of pain and gasping respiration. You will tell about the typical suffocation when the patient feels up suddenly, when he wakes up suddenly in the middle of the night, feeling as if a sponge is being held in front of the nose, patient cannot breathe properly. And you will tell about the angina pectoris. Okay, now this is peculiar in your spongia patient. See, we have told that angina pectoris is because there is lack of oxygen in the muscles of the heart. So whenever the patient is exerting, the patient has pain in the region of the heart. But in your spongia patient, this occurs in the middle of the night when the patient is in sleep. So that time patient is not exerting, but still the patient suffers from angina pectoris. So in the middle of the night, patient wakes up feeling and severe contracting pain in the region of the heart. Okay, faintness is there, suffocation is there, a lot of sweat is there, a lot anxiety in the face is there, great fear of death is there, feels as if something terrible is going to happen, wakes up feeling very much disoriented. Okay, and all these things, they tend to aggravate before and during menses in a female patient. Okay, besides this, when there are cardiac affections, there is a dry chronic sympathetic cough. This might also be there, but in productive cough might also be there. Productive means a lot of expectoration is there. So thick green yellow expectoration might also come in a patient of cardiac affections of spongia. Okay, that occurs because your heart is already affected. Now, because there is a lot of accumulation of blood in the heart, gradually it causes congestion in the lungs, and in the lungs, this kind of expectoration is there along with the cardiac affections. Okay, so these are the cardiac affections of spongia. Next, we will go on to the glandular affections of your spongia patient. Now, we have told that spongia patient suffers from glandular affections. This particularly is seen in your thyroid gland and in the testis. Okay, so what do you see in your thyroid gland? Initially, inflammation of the thyroid is there. Then gradually the thyroid gland starts enlarging, and it becomes very much enlarged and very much indurated. It becomes hard. Okay, so the gland is enlarging and it is becoming hard, indurated. It is not a soft swelling. And so much induration and enlargement is there that sometimes you can't even see the chin. The neck you can't see separately. From the chin itself, the swelling is extending up to your suprasternal fossa. So such huge swelling of the thyroid gland is there. Okay, so inflammation might be there, followed by enlargement of the gland, and gradually the gland increases in size, it becomes swollen, and it becomes very much hard, induration is there. Okay. Now, if so much enlargement of the gland is there, patient also complains along with this, it is putting pressure on your respiratory tract. So patient complains of suffocation. So here also suffocation is there. Typical suffocation of spongia, wakes up in the middle of the night feeling suffocated as if breathing through a sponge. Okay. And along with this, there is pain in the gland, stitching pain, burning pain. Okay. This kind of pain is there in the gland. Now, what is peculiar in spongia? One more thing. See, if the gland is so much enlarged, obviously there will be obstruction to your respiratory tract when you're lying down. It presses down on the respiratory tract, so you might feel suffocated. But this suffocation of spongia is also observed when the gland is not so much enlarged. Even if there is a small swelling of the gland, which is hard, then also you might get this kind of suffocation. Okay, so suffocation is there whether the gland is hugely enlarged or whether the gland is small. Okay, whether the enlargement, whether the swelling of the gland is small or large, the suffocation of spongia is there. Is that clear? Now, if a patient suffers from thyroid dysfunction, along with this, commonly what you see is affection of the heart. So with hypertrophy of the glands, with thyroid dysfunction, along with that, affections of the heart, cardiac symptoms of spongia, which we have already described before, the suffocation, the violent palpitation, the angina pectoris, all the symptoms together indicate that you must give spongia to your patient. Okay, next we go on to the testicular swelling of spongia. Okay, testicular affections of spongia. Now, when the spongia patient is having affections of the testes, what is the cause? The cause is the patient might have caught cold, because of which the testicular gland is swelling up. The patient might have had gonorrhea, which was suppressed, because of which now the testis is affected. The patient might have had an orchitis because of any other reason, but which was not treated properly. Then also there is enlargement of the testis. So the testis, initially there is inflammation, then it becomes enlarged and very much indurated. Okay, so inveterate cases of enlarged testis, inveterate cases of enlarged testis, that means now whatever treatment you are giving to the patient, it is not responding to treatment properly. So when patient come to you and tell, see, I have been suffering from this problem for a very long time, my testis is enlarged, it is hard and it is quite painful, so much painful that the patient says that I feel as if my testes are always bruised, always as if somebody has beaten up the testis. This kind of feeling is there, or it has been squeezed very hard. This kind of feeling is there. Okay, so if this kind of testicular swelling is there, it is very painful, it is very hard, and patient says that no amount of treatment is helping me. So inveterate cases of testicular enlargement. And when you go into the history of the patient says that, okay, I caught a cold in that season, and since then I have had this testicular enlargement. Or maybe initially I had orchitis, and then maybe this treatment I have taken. After that, you see the gland has become swollen and hard, and it just won't respond to treatment. Or maybe you go into the past of the patient, and the patient says, I had gonorrhea, I took some treatment, the discharge is no longer there now. I don't have any kind of urethritis or any kind of urethral discharge. Okay, which are the symptoms of your gonorrhea? But my testes are enlarged and hard, and they are not responding to treatment. So such cases of suppressed gonorrhea, maltreated orchitis, or testicular enlargement after catching a cold. Okay, and these cases have now become inveterate. That is, they are no longer responding to treatment. A prolonged case of enlarged and hardened glands is there. Then you can think of spongia tosta. Okay, so along with the testicular enlargement, patient says that above that also, where the spermatic cords are there, those areas are also very swollen and painful. You examine and you will find that area very tender and swollen. Okay, so such cases will respond to spongia very well. Fine. So this is the glandular affection of your spongia patient. Okay, but if you can give spongia not only for affections of the thyroid gland or the testicular gland, you can also think of spongia because scrofulous diathesis is there, tubercular diathesis is there in your patient. So if there is hard swellings of the lymph nodes of your neck, so lymphadenopathy is there. Okay, but it is not very painful. Painless kind of lymphadenopathy is there, and it is hard and swollen, and it is not responding well to treatment. Okay, then you can definitely think of your spongia. Okay. Acha. Besides this, now there are some general symptoms of spongia, general characteristics. One is patient usually is very much exhausted from the slightest exertion, and patient feels as if his body is very heavy. So very much very exhausted and very heavy feeling in the body from the slightest exertion. This is one general symptom. Okay. Patient mental general is great anxiety and fear, okay, which we have already described before. Okay. Another thing is patient suffers from before the menses. Okay. This is another characteristic of spongia, that before and during menses, these suffocative spells, these palpitations and all these symptoms, they tend to aggravate. Okay. And if a patient is having amenorrhea, then the patient might end up suffering from asthma. Okay. So if a patient has sudden suppression of menses and now has started suffering from asthma with the characteristic respiratory symptoms of your spongia, great dryness of mucous membranes, great suffocation, a dry cough is there, sibilant cough is there. Okay. So if these symptoms are there with the peculiar modalities of spongia, patient is having asthma, and you get into the history and you see that there has been, patient is suffering from amenorrhea, since then this asthma has come on, then you can think of spongia. Okay, so these are your some few general symptoms of your spongia patient. Okay, so this more or less covers your spongia. And in spongia relationship, aconite, spongia, HEPA-sulf we have already described. We have already described this that when spongia you have given and the symptoms are decreasing, and yet the symptoms tend to persist during the evening, then after spongia you can think of phosphorus. This also we have described in the previous class. Okay, so this more or less covers your spongia. Another thing which came up in the last class, one of you had asked me about the thirst of spongia. We had discussed it to some extent while comparing with brainia. Now you can, in the beginning, we had said, that spongia, when you toast the spongia, little iodine is released, and a lot of symptoms of spongia are because of that iodine which is released. We had told that in the last class, isn't it? Now, iodine patients, usually they have a lot of thirst and hunger. Spongia patient also has a lot of thirst and hunger. So spongia patients can both be thirsty and they can also be thirstless. But remember, thirstiness will be more characteristic for your spongia patient. Okay, so just like your iodine patients, they are very hungry and they are very thirsty. Okay, so thirst and hunger are characteristic in your spongia. But if you take cold water, spongia cough tends to aggravate, and it is relieved by taking warm water. Remember that. Okay, so this more or less covers your spongia. Next day we can discuss a little bit of more of spongia and go on to the next medicine. You go through your spongia. If you have any doubts, you can ask me.